Okay, we're going to move on to the Blue Cross programs here. We're offering our fitness discount program. So if you choose to work out 8 times per month, you can get up to a $20 credit back on your gym dues. One other adult on your health plan can participate in this program as well. So up to $40 a month you can get back on your gym dues. We have over 800 gyms participating in Minnesota and many outside of the state. If this is a program that you're interested in, once you guys all get your ID cards, you can sign up for My Blue Cross, which I'll talk more about what that is, and then go out there and it'll let you know if you should sign up at your gym or through Blue Cross Blue Shield. We also have our 24-hour nurse line. We have registered nurses that answer this line. It's telephone-based. There's no cost to you. Again, it's available 24/7, and it's similar to the triage nurse at your local clinic. We have our EAP program. Yes, question? Yes, the Anoka County Well at Work clinic. Yes, the question was, are we going to keep the clinic downstairs? And yes. With our EAP program here, you'll see it's toll-free, it's confidential, it's available 24/7. And some of the things that they can assist with listed up here are marriage, mental health, legal referrals, elder care, child care, situations at work, substance abuse, etc. With the Enhanced Stop Smoking program, up to 5 calls from a quit coach, and then up to 3 calls with a weight coach, and then your quit meds are covered at no cost to you. So they're covered through the health plan. We also have our over-the-counter drug benefit program. We have a list out on our website. On the list there are some antihistamines and proton pump inhibitors. So if you find on that list that you're taking one of those medications, you need to get an over-the-counter version prescription from your doctor. Take that to your pharmacy. They'll load that on file, and then you'll get that drug at no cost. So again, it does have to be a drug out on our over-the-counter drug list. There's some antihistamines and also proton pump inhibitors. But if that drug falls on there, get an over-the-counter version, prescription, and then take that to your pharmacy. They'll load that on file, and then you'll get that drug at no cost. And then we also have the retail health clinics. Retail health clinics, for those of you that aren't familiar with those, they're the Minute clinics, Target clinics, the Cub clinics. They're those fast, convenient care clinics. And they treat more of the minor illnesses, so strep throat, ear infection, pink eye, cough, cold, sinus infection, etc. On all 3 plans, the visits are covered at 100%. So there won't be any cost for the visit. And then also, too, the Anoka County Well at Work on-site clinic is still available, and there's no copay or co-insurance for that plan as well. Or that clinic, I should say. Any questions so far? All right, we just have a couple more sections here. Next, we're going to talk about My Blue Cross. That's out on our website as well, bluecrossmn.com. And then down at the left-hand side, you'll want to select My Blue Cross Member Center. And then this is where you're going to want to register. So once you get your ID card in December, you'll want to use that to register. And then once you're registered, you can go out there and see all your claims. So all your pharmacy, your medical claims. If you have an HRA account, that information is available out there as well. You can see where you're at with your deductible and out-of-pocket maximum. Also order ID cards. If you need another explanation of benefits from one of your claims, those are available as well. Lots of wellness information. One thing I want to mention, if you have a spouse on your plan, they will need to register under their own ID number. So you will not have access to their detailed claims information. And then I've also just put another slide in here for another website where you can go out and check out your HRA if you're interested. But again, that information is on My Blue Cross. And then our last section here is Online Care Anywhere. Online Care Anywhere is similar to Virtuell, but only better in the sense that if you have a webcam on your computer, you're able to see the live physician face-to-face. If you don't have a webcam, you can still choose to do email or phone. But with Online Care Anywhere, conversations are immediate, secure, and private, and it happens in real time. So when you log on to Online Care Anywhere, you'll answer some questions, and then right away you'll be put in contact with a physician. We contract with Fairview providers. You'll see that there's no appointments needed. The visits take about 10 to 15 minutes, so it's very convenient. A coupon code will be provided to all of you towards the end of the year. So this is going to be a free service to yourself and also your spouse, regardless if they're on your health plan or not. So anyone can use this service. Again, it is free. They can also write prescriptions, the doctors. So if you do end up needing a prescription, the prescription will follow whatever drug benefit you're on, whether the HRA or the copay plan. So just your actual visit will be free. You see a bullet here about patients must be located in Minnesota. In order to use online care anywhere, you do need to physically be in the state of Minnesota to be using this at this time. And the reason for that, again, we do contract with Fairview providers, and they're only credentialed in the state of Minnesota at this time. In the new year, we're looking at broadening that to the surrounding states and also nationally, but at this time, it's just Minnesota. And then here's just a screenshot of what the screen looks like when you're put in contact with the doctor. Any medical notes that you have with this visit will be available for you to print. Should you need to follow up with your primary care, you can bring that to them. And then lastly, just some common uses of online care anywhere. Really nice for medication refills. So as long as they're non-narcotics, these doctors can refill your prescriptions. Any questions for me? That's all I have. Yes? This is something different. E-visits, I believe so, aren't they? He asked if e-visits are covered and if online care is the same or different. Online care is different and e-visits are covered. Question?
Is Mayo Clinic available to those who are subscribing to the health partners and 100%
Yep, under the Aware Network with Blue Cross Blue Shield. The question is Aware participating with Blue Cross Blue Shield? Yes, under the Aware Network, it is. And then if you decide to take the regional network, it is a tier 2 provider. So there's a little bit of a higher cost to you as the member if you're taking that regional plan.
And since she just mentioned that regional plan, we do have up front here a overview of some of the key providers that are in the regional plan, the tier 1 and tier 2. This isn't a complete list, it's those key providers, but if you do want to look at a full list, there is also a sheet up here that talks about how to find those providers. This is also available down in Human Resources or on the Retiree website as well.
Question?
On your Blue Card Worldwide, say you're going to a specific place on vacation, you'll be able to look it up ahead of time to see what providers are available.
Yep, so he was asking about our Blue Card Worldwide, if you're able to look up specific providers. Yes, our Blue Card Worldwide is for foreign countries. So if you want to look ahead of time when you're going to that foreign country, the country and the city or the surrounding area for providers, and take that with you. Obviously, in an emergency situation, you go to the closest place possible, and it pays at the highest level of benefits. Any other questions?
Is this all just a one-year plan and then it has to be rebid again?
He asked about rebidding. We went out for bids this year. We are not required to go out for bids other than every 5 years. It is a one-year contract though, but I'm optimistic like you that we won't be changing regularly. We want to establish a good working relationship with Blue Cross Blue Shield, but it is a one-year contract with some rate cap guarantees in place for the next 2 and 3 years, I believe.
Question?
Previous question about Mayo, so on Aware Plan with $20 copay, tier 1 and tier 2 are in network?
The Aware Network, that $20 copay plan, it's in network. The Aware Network HRA, it's in network. If you're looking at that a regional network, the last plan, it's tier 2, correct. Question?
I'm kind of confused about this regional plan. So if you're doing any traveling at all or anticipate any traveling, then a person should choose the regional plan?
Nope.
I guess what's the difference between, okay.
She's asking about the regional network. The Aware Network, again, is our largest network, so that gives you access to all our doctors, hospitals, etc. The regional network is just a subset of the Aware. It's all the same providers, but we've tiered them based on cost. So the reason why the Aware plan is going to be a little bit more expensive is because you have access to all our providers, whereas the regional, if you don't use those higher cost providers, you don't necessarily have to pay for them. your deductible and out-of-pocket is lower.
However, once you get out of state, then regardless of which plan you're on, you're going to use how they have set up for their national network or international, and you'll fall under your highest level of benefits of in-network. So now that you have all this information, again, if you don't do anything and you are currently a retiree not on Medicare and on one of the Health Partners programs, if you're on the Health Partners $20 copay program, you will automatically transfer over to the $20 copay program with Blue Cross Blue Shield. If you are on the high deductible program with Health Partners, you will go to the Aware high deductible program with Health Partners, so their large network. However, if you are interested in changing plans, which may be the new Blue Cross Blue Shield plan that they're offering that uses the regional network, or you have family members to add or delete, we will need to get a Blue Cross Blue Shield enrollment form from you. It'll be important that on this form you fill out sections A, B, and C. A is your personal information, B is everyone that should be on the policy, C is the plan that you're electing. D and E will only be needed if there's other coverage that will also be in effect on January 1st. And these must be returned to Anoka County Human Resources by Friday, December 14th. Again, we do have copies of the form up here at the table. They're available in Human Resources or also on our employee website. If you do decide to take one of the two plans that are paired with the health reimbursement arrangement, and you need to set up direct deposit or you want to decline the automatic crossover, that form is also available here or in Human Resources or on that website, and these do go directly to the vendor, so you would want to mail those directly to Select Account. I do recommend waiting till mid-December to mail those, or after you at least get your form into us if you make any changes, so that when they get it, they've already gotten your form, or we've worked with Health Partners and Blue Cross Blue Shield to get that file transfer occur so they have your information. The other option is you can do it online when you get your Blue Cross Blue Shield card from them, as that'll be available online. And then the last two things I have, we did send an emergency contact sheet with your open enrollment letter. If you have not gotten that yet, you should be getting that any day. If you have not updated an emergency contact for Anoka County, we do ask that you do that. And so we have those sheets up here along with on that retiree website, as well as a beneficiary designation if you're a retiree with that $2,000 life insurance policy. If you need to update that, we have those forms available also here or in our office or on the retiree website. So thank you all for coming today. We will be around if there's any additional questions.